I am Dr. Freddie Clark of number 1 Ripon Road, and today, along with members of my staff, we will be demonstrating digital mammography and breast-specific gamma imaging, which are two technologies which we employ for the detection of breast cancer. This is an illustration of mammography. Here we see the patient's breast being positioned for the actual filming. A compression device is lowered onto the breast just to keep it still in position, and then the x-rays are made. You want to do the lateral now? It is now being positioned for the second view, which is the side view, or otherwise called the lateral view, because we obtain two pictures generally on each breast, and essentially at right angles to each other. Because the mammogram misses up to 20% of breast cancers, we also employ an additional technology called breast-specific gamma imaging. And this involves introduction of a tiny dose of radioactive material in the patient's vein, which is trapped by rapidly dividing cells, which essentially is what a cancer is. And the patient is scanned very much in the same position as with the regular mammogram, and then from that we are able to identify an area, if present, of significant trapping of this radioactive substance, which would usually be indicative of a cancer. And this illustrates the presence of a cancer in this person's right breast. This dark area represents a cancer which was not detected by mammography. As you can see, in order to perform the breast-specific gamma imaging, the breast is placed on a detector plate and just held firm by another plate. There is no significant pressure or pain involved in this, and over a period of a few minutes, the scan is done and the image obtained. Breast-specific gamma imaging is ideal for patients with dense breasts. And I think the typical age group would be between, say, age 40 and 50. This is the final presentation of a digital mammogram. On the left is the picture of the right breast, and on the right, the picture of the left breast. And one can see that they are quite symmetrical. Now, one of the wonderful things about the digital mammogram is that the image can be manipulated, and you could just observe now where we are getting a magnified view on the left side. Then we could even make the image lighter, or we could even make it darker. We can make it less sharp or sharper. This represents a significant improvement over film screen mammography, which is the traditional approach.